All right, I'm verifying the provider's order. I gather my supplies. All right, I'm knocking on the door. I'm going to close the curtain to ensure privacy. Hi, Mr. Bear. My name's Jenna Brennan. I'm the nurse. I'm going to be providing your dressing change today. How are you? All right, I'm just performing hand hygiene. I'm just going to check your ID band. May I see your ID band, please? Okay, may I have your first and last name? Okay, your date of birth. All right, and what year is it? And who is the president? Good, it's good to see that you're able to answer everything okay. All right, I'm just going to verify with the MAR and make sure that everything checks out. We're doing the right thing today. We have the right person, the right patient, I mean. All right, everything checks out. I'm just going to make sure that the patient's comfortable with their head elevated. If they have a PICC line, I'm going to make sure that their arms extended. All right. And then I'm going to perform hand hygiene. And since it's COVID-19, they have their mask on. I'm going to put my mask on. And I'm just going to apply clean gloves. All right. Mr. Bear, if you don't mind turning your head to your left. I'm just having the patient turn their head away from the bandage so that way I can get to it. All right, let's get that ready. So we're going to pull everything away from the skin. And then we're going to take off any steri strips and stabilizers next, and all that's going to go in the biohazard. All right, so it's placed in the biohazard. I'm going to take the alcohol swab and clean around it. Just make sure it's not tacky or sticky. Does that. All right, and then I'm just going to inspect the site near the PICC, and if I need to, I'm going to measure the circumference of the arm and check for any signs of thrombosis. All right, and they look good, no signs of thrombosis there. And then I'm just going to remove my gloves, and I'm going to perform hand hygiene. And then I'm going to open up away from me. This is all sterile. And I'm going to, first I'm going to take my steri strips and toss it in there. I don't have them, so I'm pretending. All right. I'll take out my sterile gloves. And I know I only have that inch to work with. Now I'm going to leave that cuff there. And I'm going to take this underneath, make sure that we're staying sterile. Leaving a cup. Now I'm going to take the chlorhexidine, and you're just going to do a back and forth motion and a horizontal and vertical motion, and you're going to do that for 30 seconds. Make sure to get around the And then you're just going to let that dry for 30 seconds. And then you're going to take your protectant and you're going to wipe around with the protectant. And then you're going to, we're going to get our dressing ready. First I'm going to make sure that this is cooled around. And we're going to with the dressing. And we'll put a steri strip over it first. I don't have any, so I'm just pretending. And then I'm going to actually put that on there. Okay. And then I'm gonna take off the piece for labeling. Alright. And then I'm going to remove my gloves. I'm going to perform hand hygiene. I'm going to take my pen, I'm going to write the date, time, and my initials on paper, and I'm going to label the dressing. And then I'm going to make sure that I clean up everything. Alright. And then that's the dressing change. Going back, I'm just making sure if anything I did miss that I may have wanted to added. Maybe before doing the dressing change, maybe I would have asked the patient if they're in pain. But Mr. Bear was not in any pain, so it was safe to do the dressing change. I think overall, I think I got everything.